Chair, and thank you, Mr. Secretary, for being here today. The Wall Street Journal on April 12th, John C. Goodman wrote in the opinion page, "Trump is making the best of Obamacare." And in that article, he talks about the 2027 ACA exchange rule, which would allow health insurers to offer non-network plans on market exchanges. Health insurers would be able to set reference prices. And actually, this is a really clever idea, and I'm just curious, your thinking on it, and if it's one of those things that someone has been trying to get in place for years. I happen to think it's excellent, but perhaps I'm wrong. What do you think?
Can you just repeat the proposal?
Yes, the idea is that a non-network plan on an exchange would be able to set reference prices. For example, you could say $30,000 for a knee replacement, and then the person who enjoys that insurance coverage could shop around and select other providers to do the work. They wouldn't be stuck inside the space that they might have been required to obtain the coverage from. It's very clever, and it suggests competition as opposed to being stuck someplace. But there's lots going on in this insurance space, so I would enjoy your thoughts.
Yeah, I mean, that is President Trump's solution, that we need markets. Markets bring down prices. And Congressman James just talked about price transparency. When we looked at pregnancy deliveries in New York, within a mile of New York, we found 30 hospitals. The lowest was $1,300. The highest was $22,000, exact same procedure. In Detroit, it was $6,000 and $60,000. The reason you have that market chaos is because nobody can choose prices. The more that you impose market disciplines on a market, the lower costs are going to go. It's ultimately the only way we're going to get healthcare costs down, that and ending the chronic disease epidemic.
Well, it seemed to me that in studying this situation, this kind of thinking is exactly what we need, because when I go back to my district, the amount that people are paying for health insurance is through the roof. And so this kind of transparency is one step. I'm sure there are others. I think in the budget, I note a few. Do you have, I think you've put in your testimony what you think would drive down prices, but perhaps you can share with us other ideas that will drive down prices. Just so I may share with you, one of my brothers is paying $26,000 a year for coverage with a $10,000 or $13,000 deductible covering two people. So what in the world can I go back to him and say, hey, the administration is working on trying to drive these prices down?
Yeah, I mean, we have literally dozens and dozens of programs and initiatives for driving prices down. The biggest one is ending the chronic disease epidemic. In 1960, when my uncle was president, we spent zero on chronic disease in this country. Now we spend about $4.3 trillion a year, and it is rising exponentially. So that's one issue that we are addressing for the first time in history. The drug pricing, the MFN, we were paying the highest price in the world, 10 times in some cases what Europeans were spending for the exact same price that was made in a factory in New Jersey. And now we're paying the lowest prices in the world. The cost sharing, which is the president's proposal, will lower costs, will lower premiums by 10%. And then, I'm sorry, price transparency. Obviously, if we have markets going to drive down prices, the waste, fraud, and abuse, which is costing us $100 billion a year, that will drive down prices. Ending upcoding in Medicaid, which we are finally doing. We're the first administration that's ever doing it. That will lower prices. And then cleaning up the risk pool, cleaning up people who don't belong on Medicaid or Medicare or in the exchanges. When you do that, you improve the risk pool, so that's going to lower prices, and all of those things and many, many others are being done by this administration.
Happy to hear it. Thank you, Mr. Secretary. Yield back.